right, an uptick in coronavirus cases in South Asian nations like Singapore and Hong Kong sounded an alarm bell. This time around, India is taking the prevention is better than cure approach quite seriously. The Ministry of Health and Family Welfare held a meeting with experts of ICMR, National Centre for Disease Control, Disaster Management Cell and Emergency Medical Relief to review the scenario on the 19th of May. But there is no reason to worry. The authorities say there are 257 cases in the country. All of these cases are mild and have not required any hospitalization either. Since January, there have been only 2 deaths due to COVID and both due to pre-existing comorbidities. One of the patients there suffered from cancer and the other 2 had nephrotic syndrome. The authorities are vigilant and prepared for even a slight surge in cases. ICMR has a robust system for surveillance of COVID in case the situation worsens. In Hong Kong and Singapore too, the cases have been mild and these countries in fact have not reported any deaths so far. Let me quickly go across to Dr. Anil Gurtu, HOD, Department of Medicine, Sitaram Bharti Institute. I'm also joined by Professor Dr. G.C. Khilnani, Chairman, Department of Pulmonary and Critical Care, PSRI Hospital. I'll start with you, Dr. Gurtu. A very warm welcome to News9. Sir, do tell us, what could be really driving the current surge globally? We're seeing cases rise in Hong Kong, Singapore. Are we really seeing a new variant or a sub-lineage?
Actually, these periodic surges, the ebbs and rises and surges are to be expected from the very behavior of this virus, coronavirus. What probably has happened, from whatever we know from what's been happening in Singapore and Hong Kong, is that a new subvariant belonging to its original ancestor remains Omicron, which first emerged in November 21, and its sublineage JN1, which emerged for the first time sometimes in December 23. This and its subvariants, which carries over 30 different mutations in its spike protein, is demonstrating an expected tendency, which is, while it causes very mild disease mostly, it is far more transmissible. Because of these aggregated 30 mutations, these subvariants of JN1 are better at evading our immune defenses and getting into our body system. So while more transmissible, they are also milder in terms of clinical expression of disease form. So it's expected that we will have a surge of mild cases mostly. And that is what's happening. And this is a phenomenon that will keep happening because it's now become an endemic. That is, it got embedded within our ecosystem, the human and environmental ecosystems interactively. It has got embedded there as an endemic virus, much like other coronaviruses, which are even older. And periodically, they will keep creating surges and then declining, disappearing, reappearing, and milder illnesses that way. And so that is what's probably happening. Yeah.
All right, continue to stay with us, Dr. Gurtu. Let me come to you, Dr. Khilnani. Most of the cases, most of the recent cases in India, like Dr. Gurtu also said, are said to be mild. What defines a mild case today, sir?
So we have to understand that the dreaded thing of 15 million extra deaths in 2020-21 still is fresh in our mind. But we need to understand that coronavirus is notorious for mutations, and it has been there for ages. That COVID-19 is a special virus, and I would like to tell you the characteristics of Omicron virus, of which this JN1 virus is a descendant actually. So Omicron, fortune, is a virus which is a COVID-19 virus, but by its character, it is confined to the upper airways only. It doesn't go to lower respiratory tract to cause severe pneumonia and ARDS and ICU care and so on and so forth. So that is the reason that for WHO says that it is a virus of interest, not of concern. The interest means you have to keep your eyes open and keep surveillance because this virus is notorious uh, for mutations. Another thing is the characteristic of this virus is RO, that is infection rate. The original Wuhan virus had the RO of 2.5. That means if there are 100 cases, uh, one case can infect 2.5 cases on an average. Delta had a factor of 5. Omicron has a factor of more than 8. That means it is very contagious. It transmits very fast but causes mild illness. Why I'm telling you? Why I'm telling you that although it does not kill, does not cause pneumonia in a person who is normal, who is immunocompetent, but those who have got cancers or who are on steroids, who are severely diabetics, or who are 80 years plus, ought to be careful in case of a spread of this virus in this country. So far, 250 cases have been reported from India, but it may increase, the number may increase. There's no reason for panic, absolutely no reason for panic. But as you rightly said, Neha, that the government of India has taken cognizance of this. So the surveillance is important. The genomic mapping is important. It we must follow it up that it does not take a dangerous turn, in terms of mutation. So far, there's no evidence. Two patients who have died in Bombay, as you rightly said, they have died with COVID, not because of COVID. So at the present time, we are sort of in a comfort zone. There may be more cases which are not being tested and detected because the upper respiratory tract infection is so common. We treat it as viral infection. Sometimes it is influenza, sometimes it is HMPV virus. So it should be taken as one of the flu type of viruses which requires surveillance. Thank you.
Right, continue to stay with us, Dr. Khilani. Dr. Gurtu, on that note, I'd like to ask you, should people start masking up again in crowded spaces or public transport?
See, we have to place the mask in its proper epidemiologic context, which means the risk of transmission happening. Now, the risks of transmission happening are most in enclosed spaces with no or poor cross ventilation, such as crowded places inside auditoriums or small rooms or chambers where there are no windows and doors which are open. So, in these circumstances, if someone is unwell, he or she can transmit to others. So, if you are unwell, you are having fever, cough, cold, it's better to be masked when one goes out or comes in contact with others. Or if one is in a situation where there are likely to be infected patients in a hospital, in a ward, it's better to go masked. Otherwise, in open spaces, outdoors, one has to simply observe those fundamental principles of hand hygiene, washing the hands before and after, touching frequently touched spaces, entering and exiting a room, uh, cough and sneeze etiquette, that is, using any handkerchief or some disposable thing to cough and sneeze. If that is not available, then use a bent elbow to cover your mouth and nose, but do not cough directly into your hands or onto someone else's face. And these are the droplet etiquettes, maintaining a distance in crowded spaces if it's possible. So with these, it should be enough. Masks should not be there for, say, outdoors or going out in open spaces or well ventilated places. Their simple etiquette, cough, and hand hygiene is enough.
Continue to stay
Yeah.
with us, Dr. Gurtu. Dr. Khilani, how prepared is our healthcare system if a surge were to happen again?
So we are well prepared in terms of that. during COVID time that RT-PCR majority of labs are well equipped. But I would like to bring in another issue that is about vaccination. We all are vaccinated, but with the course of time, as the science suggests, that our immunity wanes, goes down with the course of time. The China and Thailand have already advised their population, especially elderly, to get a booster vaccination. So what does the vaccination do? One, that the vaccines which are available with us will be useful for this Omicron virus also, but unfortunately, it does not reduce the chances of infection significantly. What it does is that it reduces the severity of infection, requirement of ICU admissions, and death. So, government of India has not taken any call. This is a big call whether the vaccination restart. My personal thinking is that it's not necessary at this particular moment. But this question is a frequently asked question to me and all the physicians because everybody is worried. They ask whether we should take a booster dose for COVID vaccine. So my answer to the present thing is. It is not required at the moment unless somebody has comorbidities. The question that you asked, are we prepared? Yes, we are prepared both ways. One, that the diagnostic facilities are available. We have advanced virology labs which will be able to map the genomic sequence and find out which kind of sublineage of virus is coming and take necessary action. Our uh, population is well educated on use of uh, uh, the hand hygiene and the use of mask if it comes necessary. But it is important to know that one should those who are susceptible must avoid crowded places. Now, when you go to the crowded places, like we had a lot of patients with viral infection when they return from home because there are swarm of people. So those susceptible must should avoid going to the people where there are 1,000 people, 500 people. The chances of transmission are high, and you do not know who is carrying which kind of virus. So presently, these kind of precautions are good enough. Otherwise, we are in comfort zone.